Hey there, and welcome back for another deep dive. Today, we're going to be taking a look at something really interesting. We're diving into the world of epilepsy treatment and how it connects to mental health. You sent us some really compelling research about using cannabidiol, CBD,
Right.
with adults who have drug-resistant epilepsy. And I got to say, I was really interested right away.
Yeah, it's a hot topic for sure. This particular study, it really caught my eye
Okay.
because it goes beyond just looking at like seizure control
Right.
and digs into how CBD impacts depression, anxiety, even the quality of life for these patients.
Okay, so let's unpack this a little. We're talking about a study called, the title is a mouthful, Psychiatric Comorbidities Before and After Cannabidiol Treatment in Adult Patients with Drug-Resistant Focal Epilepsy.
Wow.
Fresh off the press this month, October 2024, from the journal Epilepsy and Behavior. So for those of us who, aren't familiar with this, what exactly does drug-resistant focal epilepsy mean for these patients?
Well, simply put, it means their epilepsy doesn't respond very well to the typical medications. So imagine, you're living with this constant threat of seizures,
Oh, wow.
the fear, the disruption to your everyday life. It's incredibly difficult. And when those standard treatments fail, finding new options, that becomes absolutely crucial.
Yeah.
Not just for managing the seizures themselves, but for their, their overall well-being.
That makes total sense. So this study, they were looking at whether CBD, in addition to a patient's regular epilepsy meds, could actually improve their mental health along with their seizures, right?
Exactly, yeah. They wanted to see if there were benefits beyond just stopping the seizures,
Okay.
And what they found is it's actually really quite remarkable, particularly when you look at depression.
Okay.
So before using CBD, about half of the patients were dealing with, significant depressive symptoms. But here's the interesting thing. After treatment with CBD, 95.4% of those patients, those individuals, showed significant improvement in their depression.
Wow, 95.4%.
It's huge.
That's almost everybody.
Yeah.
The study even says nearly 72% of those patients reported minimal or no depressive symptoms after using the CBD.
Yeah, it's a substantial improvement.
Yeah.
And it's not just depression either. They saw a very similar pattern when they looked at anxiety. Over half the patients, again, had anxiety symptoms before the CBD treatment, and afterwards, 71% said, you know what, those symptoms, they've gotten better.
Okay, so we're seeing like a pretty clear trend here.
Yeah.
But what's the connection? Is it simply that managing the epilepsy with CBD takes away some of the stress and uncertainty of living with those uncontrolled seizures, and then that improves mental health?
That's a great question. And it's definitely something researchers are, trying to figure out, digging into.
Okay.
See, this study, it also found a really strong connection between having fewer depressive symptoms and just a better quality of life for these patients.
Okay.
They actually used, standardized questionnaires. Like they used something called the Beck Depression Inventory, or BDI-2. And they used a quality of life questionnaire called the QOL-IE-10.
Okay.
So this wasn't just about, people saying, oh, I feel better. They had the data to back it up.
So no guesswork here. They had concrete measurements to show, how much improvement there was. But how does that work? What's the link between something like depression scores and someone's overall quality of life?
That's where it gets even more interesting. So when they really dug into the data from these questionnaires, they found a statistically significant positive correlation.
Okay.
Basically, what that means is the less depressed someone felt after that CBD treatment, the better their quality of life became.
Wow.
And that connection is crucial because it really highlights how CBD might not just treat those physical symptoms of epilepsy,
Right.
but it might actually have these ripple effects
Wow.
and positively impact the mental and emotional well-being of the people, living with this condition every day.
So it's not just about stopping the seizures. It's about improving the whole picture
Exactly.
of their health.
The whole picture.
That makes a lot of sense. But I'm curious, were there any other really significant findings from the study that we haven't touched on yet?
Yeah, there's one finding that really struck me,
Okay.
and it was how quickly a lot of these patients actually experienced improvements in their mental health after they started the CBD treatment.
Really? How quickly are we talking? Because with a lot of treatments, you don't always see those kinds of results immediately.
We're talking a matter of weeks.
Okay.
Sometimes even days.
Wow.
Some patients said they felt a noticeable difference in, their mood, their anxiety levels, and this was all within the first month of adding CBD to their treatment plan.
Wow.
Now, it's important to say this wasn't the case for everybody.
Right.
Some people, it took a bit longer to really feel those full effects.
Okay.
But this rapid improvement in a good chunk of the people in this study,
Yeah.
it really highlights how powerful CBD could be, especially for the mental health aspect, those challenges of living with epilepsy.
That's incredible to hear, especially for people who have maybe been struggling to find relief, for a long time. I mean, waiting months for a treatment to even start working can feel like forever when you're dealing with something that really impacts your life, like debilitating depression or anxiety.
Absolutely.
On top of everything else.
Absolutely.
It makes you think about how it actually works. Like if CBD can have such a quick impact on mental well-being,
Right.
is it possible that it's like targeting something different in the brain?
Yeah.
Compared to traditional antidepressants or anti-anxiety medications?
Just hit on a really important point, and it's definitely something that researchers are actively looking into.
Okay.
So while traditional antidepressants, a lot of times they work by increasing serotonin levels in the brain.
Right.
CBD seems to work a little differently. It mainly interacts with the endocannabinoid system,
Okay.
which it basically helps regulate a whole bunch of functions. We're talking mood, sleep, even how you perceive pain.
So it's not just about changing one specific chemical. It's more about working with this whole system that keeps your body balanced.
Right.
That's really fascinating.
Yeah.
But, with any new treatment, I imagine there are limitations. There are potential drawbacks that, we should probably talk about.
Oh, absolutely. It's incredibly important to keep things in perspective,
Right.
So while this study, it has some really promising results,
Yeah.
it's really important to remember it was a relatively small group of patients.
Okay.
And more research is going to be needed to really confirm these results.
Right.
And see what the long-term effects are.
That's a really good point. It's easy to get swept up in the excitement of a potential breakthrough.
Absolutely.
But you always want to balance that out with a little bit of caution.
Right.
And speaking of caution, are there any potential side effects associated with using CBD that, we should mention?
Yeah, definitely. While CBD is, generally well tolerated, it can cause some side effects, things like fatigue, drowsiness, maybe even changes in appetite.
Okay.
And it's also really, really important to be aware of how it might interact with other medications.
Right.
Especially if someone is already taking multiple prescriptions.
Yeah.
That's why, talking to your doctor
Yes.
is absolutely key.
Communication is key.
They can help you figure out, do the benefits outweigh the risks in this case?
Right.
Is CBD the right choice for you and your specific situation?
It sounds like this is really emphasizing how important personalized medicine is.
100%.
Where the treatment isn't okay, this is what we do for everybody. It's let's tailor this to you, to your needs, to your medical history.
Yeah.
This study was focused on adults with drug-resistant focal epilepsy.
Right.
But what about other types of epilepsy?
Yeah.
Is there any reason to believe that CBD might offer similar benefits for those people?
That's a great question. And while this particular study didn't look into other types of epilepsy, there is more and more research coming out that's looking at, could CBD be helpful for a wider range of epileptic conditions?
Okay, so for those listening who might be thinking, hey, this is great, but I have a different type of epilepsy, there's still hope. And there's ongoing research.
Absolutely.
That could shed some light on how CBD might help them too.
Exactly, yeah. This is a field that's constantly changing, and CBD is definitely a promising area of research.
Okay.
Now, it's important to remember that while CBD shows a lot of promise, it's not a cure-all.
Right.
It's not meant to completely replace those traditional treatments,
Right.
but rather to be used alongside them
Yeah.
as a complementary therapy.
Yeah.
And of course, always with your healthcare provider.
Right. It's about adding another tool to the toolbox
That's it.
to give people with epilepsy more options.
Yeah, exactly.
And, hopefully improve their quality of life in a more complete way.
100%.
Speaking of which, this study mainly focused on CBD's impact on mental health when it comes to epilepsy treatment.
Right.
But are there other potential benefits of CBD that are being researched in other areas of medicine?
Absolutely. CBD's therapeutic potential, it goes way beyond just epilepsy.
Okay.
Researchers are looking at how it could be used for things like managing chronic pain, reducing inflammation, helping with anxiety and insomnia, even lessening some of the nasty side effects of cancer treatments like chemo.
Wow. So we're talking about a compound that could potentially be used in so many different areas of medicine.
Yeah.
That's pretty amazing. Really sounds like CBD is like changing how we think about health and well-being.
Yeah, I think so.
But before we wrap up, let's go back to like the main point of this whole deep dive. You've walked us through the research, the findings, the good stuff, and even some of those things to watch out for with CBD. For someone listening right now, maybe they're dealing with drug-resistant epilepsy themselves, or they know someone who is. What's the one big takeaway from all of this?
I think the biggest thing here is that our physical health and our mental health, they're all connected.
Right.
For a long time, we've treated them separately.
Yeah.
But this research really shows us how much they actually affect each other. And this study, it suggests that by treating the epilepsy, the root neurological problem with CBD, we might be able to make a real difference in the mental and emotional well-being of those living with this condition. It's about looking at the whole person.
Right. Not just zeroing in on one specific problem.
Exactly.
Treating the whole person.
And while we always need more research,
Of course, yeah.
this study, it offers a lot of hope. And not just for those with drug-resistant epilepsy, but for everyone who's, looking for ways to feel better, live better.
Yeah, it's a good reminder that we should always keep looking for those new possibilities.
Yeah.
And, we should never be afraid to advocate for our own well-being, our own health. So for those of you listening, if this deep dive has, sparked your curiosity, remember, knowledge is power. Talk to your doctor. Stay informed. Keep asking those questions. Until next time, keep diving deep.